We would normally make contact with the school sort of early on, like via phone, just to make sure, like with the young person's permission obviously. And some young people don't want us to do the whole school thing, but we do find it really quite useful as well, especially if we know that they're going to be going back to school. So we would make initial contact over the phone, and then we would work out a plan with the young person to what they want. So we kind of usually offer a couple of things. First of all, it would be a meeting with their teachers and maybe the assistant principal or their year coordinator to talk about all the educational requirements. And we can do that in liaising with for example, we have a learning program coordinator at our hospital, so we liaise with her, and her background is education, so she might come along with us to the visit to make sure if they needed special forms filled in for HSC, or if they're trying to get their ATAR and apply to universities, that we make sure every possible form is filled in to give them the best opportunity to still be able to pursue whatever it was they wanted to do. So there's that's the first thing that we do, and the other thing would be to organise a time to meet with their peer group. So sometimes that can be the whole year group, like the young person will say, yeah, I want the whole year group there, so it would be 200 kids in an auditorium, and we would go and stand up the front and talk just sort of generically about what the disease is, like the diagnosis, what the treatment involves, so what some of the side effects of that may be, like, they're going to look different, hair's going to fall out, they might lose weight or gain weight. And we would also talk about things if the young person was coming back to school, because they can go back to school in between sort of treatments if they're feeling okay for bits and pieces of time. So we would go and talk about how to keep them safe at school. So things like if you've got a cough or cold, just that infectious disease sort of stuff that the young person needs to not be seated near you, and it's okay if they just say, I'm going to not sit near you today, I'm going to go and sit over there if okay, just to make sure that they don't, be offended by that. So just to keep them safe from an infection point of view, and no rough and tumble kind of play, no that sort of stuff. So the real medical safety issues, and we also will talk about how they can support the young person while they're having their treatment, as far as make sure they still invite them to things, even if they can't go, just to really keep them included. If they can use social media in a positive way, we always touch on the social media thing, obviously because it can be overwhelming, but it can also be a really useful way of keeping the young person connected. And we also just do like a bit of a public health, we talk about lumps and bumps and not ignoring things to the young people, so that because early detection and all that, so we always do a little bit of a sort of public health talk in there. And then sometimes we do a smaller group, like if they've got a smaller group of friends that they want more in-depth conversations with, we can meet with them as well. And we also do siblings, so if they've got a sibling at the same school in year 10, then we'll meet with, not usually a whole year 10 group, but we'll ask that young person if they want us to meet with like a group of 10 or something of their friends just to talk. So we include siblings as well if they're at the same school.